Hello friends, let us now learn some important points about the one more important thing, that is Monroe-Kelly doctrine. This Monroe-Kelly doctrine is it is, what do we say, it is a concept which tells us about the increase in intracranial pressure. So in this, if you see, first we have three compartments in our skull. We have venous blood, we have arterial blood. See, this is skull. Okay, in the skull, if we see what are the things that we will have venous blood, we will have arterial blood, brain and CSF. This skull is a closed cavity with constant amount of volume. The skull is constant amount of volume. You cannot increase the size of the skull, right? So for example, if there is a mass or tumor in our brain, then obviously this mass or tumor is now pushing the brain, venous blood, arterial blood and CSF. It is compressing these areas, and as a result you will see increase in pressure. The pressure which is seen here is increased intracranial pressure. So there are one opening which is present here, that is the jugular foramen. Through the jugular foramen the skull opens down. Through the jugular foramen there is passage of medulla oblongata, down there is spinal cord. So that will help in, that is the only exit for the skull. So if there is increased intracranial pressure and it increases such that our skull cannot hold the increased pressure or increased volume of brain, then it causes herniation. So this is the herniation which occurs because of the opening. Okay, so whenever there is mass or blood in the brain, first and foremost there is increase in intracranial pressure. First, cerebral perfusion pressure. Cerebral perfusion pressure is equal to mean arterial pressure minus intracranial pressure. Mean arterial pressure will be 90 to 110 millimeters of Hg, whereas intracranial pressure will be 5 to 10 millimeters of Hg. So if you calculate this, the cerebral perfusion pressure comes to be around 70 to 105 millimeters of Hg. These values are important. So whenever there is increased intracranial pressure, there is decreased cerebral perfusion pressure because it is compressing on both veins and arterial supply. So overall the blood vessels of the brain will get compressed, and as a result there will be decreased cerebral perfusion pressure, which will lead to ischemia and hypoxia. This will cause edema, which is secondary brain injury, which will again lead to inflammation and necrosis. This increase in intracranial pressure will cause the brain parenchyma to herniate down. Right? So if we draw a graph with mass lesion with intracranial pressure, you will see it like this. So the first stage here which you see is starting to increase the intracranial pressure. When the size of the mass increases, the intracranial pressure is constant. Here if you see, there is increase in size of the mass, but intracranial pressure is constant because there is compensation is done by the brain. And after that if you see, there is loss of compensation at this stage. At this stage here there is loss of compensation. So as a result the intracranial pressure starts to increase rapidly, even with small change in the mass size, and at the end, once it becomes maximum, there will be brain herniation occurs. Right? So the next, after head injury, the pupils will dilate ipsilaterally. See, there is, after head injury, what actually happens is there is dilatation of pupils, and these pupils will dilate ipsilaterally. This is because there is ipsilateral brain parenchymal herniation will cause dilatation of pupil. This ipsilateral brain herniation, which is causing dilatation of the pupil on the same side, this is called as Monroe's doctrine. Okay, now as we have said, the summary of this whole story is there is increase in intracranial pressure, which will cause herniation of brain parenchyma, which will lead to the dilatation of the pupil ipsilaterally. So this is important. Now, treatment of the intracranial tension. Intracranial tension can be treated by first elevate the head end of the bed to 30 degrees. The goal of treatment is the intracranial pressure should be less than 20 millimeters of Hg and the cerebral perfusion pressure should be more than 70 millimeters of Hg. Then the first line therapy is for to decrease the intracranial pressure. Here we should do CSF drainage should be done with either external ventricular drain, with either by either putting external ventricular drain or by either ventriculostomy. With one of these procedures, you should first and foremost decrease the intracranial pressure. Okay, then even after CSF drainage, even if IC intracranial pressure is persistently elevated, then the patient should be sedated. Even after sedation, if it is raised, then you should give osmotic agents like mannitol are administered. If still there is raised raised cerebrospinal fluid, raised intracranial pressure, then you should go for hyperventilation. Even after hyperventilation, if still there is raised intracranial pressure, then we should do decompressive craniectomy should be done, where you remove the part of skull, and once you remove the part of the skull, one bone of skull like temporal bone, and this will decrease the intracranial pressure. Then we have other treatment modalities are also present for refractory increase in intracranial pressure. Mainly, if there is if at any time there is refractory increase in intracranial pressure, then we should do decompressive craniectomy. Then we can do aggressive hyperventilation, high dose barbiturate therapy, or hypothermia can be given. So this is about the treatment of intracranial pressures. So in a head injury patient, key parameters that we should always remember include partial pressure of oxygen should be 4.5 to 5 kilopascals. Partial pressure of oxygen should be more than 11 kilopascals. Mean arterial pressure should be 80 to 90 millimeters of Hg. Intracranial pressure should be less than 20 millimeters of Hg. Cerebral perfusion pressure should be more than or equal to 70 millimeters of Hg. Sodium should be less than 140 millimeters of Hg. See, intracranial pressure should be less than 20 millimeters of Hg. CPP, that is cerebral perfusion pressure, should be more than 70 millimeters of Hg, and sodium should be more than 140 millimeters of Hg, and potassium should be more than 4 millimoles per liter. So these are the different parameters which are important in head injury patient. Thank you for watching.